The most common symptom is gonna be cyanosis, which is when the skin, the lips, or the nails turn blue due to the low oxygen in the blood, and we can kind of see that on the bottom right here. And the cyanosis can be mild or very severe depending on their condition. One really important thing I wanted to share is something called the TET spells. It's also known as hypercyanotic or hypoxic spells. And these are basically sudden episodes where the baby's oxygen drops quickly. They may exhibit signs like cyanosis, tachycardia, tachypnea, and become very irritable or difficult to calm down. And to understand why it happens, I just kind of wanted to explain a little bit about what kind of happens in the heart. So normally, right, when the blood reaches the right ventricle, normally it's going to go through the pulmonary valve straight into the lungs to get oxygenated. But in TOF, that doesn't happen. Instead, it's blocked, and there's a narrowing called the right ventricular outflow tract obstruction. It's also shortened to RVOTO. This basically blocks that blood flow to the lung. Then there's a hole between the right and the left ventricle, and it's called a ventricular septal defect. So during the episode, the narrowing basically gets worse and worse, and there's pressure buildup in the right ventricle, which forces the blood to flow from the right ventricle to the left ventricle, completely bypassing the lungs. So it doesn't get oxygenated as a result. So then basically oxygen poor blood is pumped out of the body. So that's why it causes the baby to turn cyanotic very quickly. And there are things that can also trigger the TET spells as well. So we have things like crying, feeding, being in a warm environment, or even during the morning hours when the blood vessels naturally relax. These spells are dangerous, and if they're left untreated, it's very serious because it can cause metabolic acidosis, seizures, stroke, or even death. And when we are doing a physical assessment on our patient, during the heart assessment, another symptom or a sign we might hear is a loud whooshing sound. It's called a systolic murmur. This murmur is caused by the pulmonary stenosis, and it's usually heard along the mid to upper left side of the chest. And then right after birth, some infants may have severe cyanosis, but others might exhibit, like they might just be fine, asymptomatic, and then later develop cyanosis. And in early infancy, cyanosis may be mild or absent, but tends to worsen over time.